Hello, NephU community. My name is Jill Green, Medical Science Liaison with Otsuka Pharmaceutical Development and Commercialization. I am here with Glenna Frey to give her personal perspective on the field of nephrology nursing. Glenna has over 35 years of experience as a nephrology nurse. She is the co-founder and co-executive director of Kidney Donor Conversations, Inc., a nonprofit founded in 2018 to provide education about living kidney donation. This is a true passion of hers, as Glenna herself is a living kidney donor. Currently, Glenna is a healing care practitioner assisting outpatient oncology patients with relaxation, guided imagery, aromatherapy, and healing touch. Thank you for joining us. Glenna, can you tell us what nephrology nursing means to you?
Yes, I think the most important thing about nephrology nursing for me is really advocating for patients, providing them education about their disease, disease progression, all of their options for treatment, making sure they have informed consent, and really just being a support and mentor to them as they go through their disease and trying to help kind of meet them wherever they're at and assist them however we can as nurses.
That's great. So can you share a little bit about why you decided to go into nephrology?
Yes, I was a nursing student at medical college and was working at the hospital there, and I was floating as a nursing assistant and found that the thing I liked the best was working with the kidney transplant patients. We would provide one-to-one nursing care for 3 days while they were in isolation after surgery. And I just really got hooked on the whole idea of kidney transplant. I took a job there after I became a nurse, and then I learned peritoneal dialysis, hemodialysis, and just really became hooked on nephrology at that point.
That's great. So what could you say is the biggest reward within your profession?
I think just making that connection with patients, knowing that you made a difference in their life by, again, meeting them wherever they are and helping and assisting them and their family through this disease. It's really complex to be diagnosed with kidney disease, and I just get rewards knowing that I was there helping and assisting in some little way.
Glenna, can you tell us a memorable patient experience?
Yes. Last year, my daughter and I, after we started Kidney Donor Conversations, we were at a community event to increase awareness of organ donation. And we had our table set up, and this woman came up to talk to us. And she asked a lot of questions, and we talked about what it was, to be a living donor. And before she left, she said she would want to donate her kidney. And so I asked her if I could talk with her later and have phone call. And so I contacted her, and over the months, kind of helped her through the process. And literally 8 months after that, she donated her kidney, and someone was able to get off dialysis.
Wow, that's amazing. To kind of shift gears, what is your biggest challenge being a nephrology nurse?
Well, I get frustrated sometimes when I see that patients aren't getting the best care that I think they should be getting. And it kind of starts even from primary care physicians. If they're not checking, for example, GFRs on patients who are diabetic, or not referring early to nephrologists for care that the nephrologist could really manage better. And then even once people are diagnosed with kidney disease, making sure that they have all the options known to them and have good informed consent. Sometimes I see too many people going on inpatient dialysis without even knowing about the benefits of kidney transplant, the benefits of living kidney donation and transplant. the home therapies, peritoneal dialysis, home hemodialysis. So that's really disappointing for me as a nurse, and that's part of my passion, is really getting those messages out to people so that they understand their options and choices.
That's great. Glenna, do you have any advice for nursing students who are thinking about specializing in the nephrology field?
Wow. Nursing itself gives such a vast array of options. And even within nephrology nursing, there are so many aspects that you can do, between caring for patients with acute kidney injury in ICU, the acute care setting, inpatient dialysis, outpatient dialysis, peritoneal dialysis, home hemo, case management. Nurse practitioners have awesome opportunities now, and we need more good people and good nurses that are really intelligent, caring for these complex patients. Kidney transplants. There's just so many niches within nephrology that makes this career really, really a great opportunity.
So Glenna, can you share maybe some personal experiences that has helped shape your professional career?
Yeah, I would say when I married my husband, he had already been diagnosed with polycystic kidney disease. And so I watched his father do home hemodialysis and later get a transplant. And then when my husband progressed with his kidney disease, he was on hemodialysis a couple months before he received a kidney transplant, which he's had for 17 years now. And so I think watching that disease progression and seeing the different treatments has given me a very unique perspective on nephrology nursing also. And then in addition, once I decided to donate my kidney in 2017, that also expanded my experience so that I was comfortable enough then to start the nonprofit Kidney Donor Conversations. So I think all of those really wrapped up into, making me the nephrology nurse that I am today.
So to finish up, Glenna, can you tell us, what do you like to do outside of nursing? What are your hobbies?
Well, I do like to read and garden, but I'm a low maintenance gardener. And I like scrapbooking. I have lots of scrapbooking from when my kids grew up that I haven't actually finished yet. So, and I also have training in Tai Chi, Qigong, and I'm a first degree black belt in Taekwondo.
Wow, very impressive. Well, thank you so much, Glenna, for sharing your personal perspective on the nursing nephrology field. I want to thank Glenna for joining us today and shining a light on the nephrology nursing field. Thanks for tuning in, and we hope you enjoyed the discussion. We will see you next time here on NephU.